Thank you, Mr. Speaker. I asked this question and didn't get an answer, so I will try it again today. To the Premier, will you commit today that your government will keep its promise to not lay off or reduce hours of teachers and nurses during this term of office? Yes or no?
Good question.
Honourable Premier.
Well, thank you, Mr. Speaker. I thank the member for his question, and I certainly hope that our exchange today doesn't put any of his guests to sleep. Let me just suggest that our government will continue to invest in public health care, and we will add more frontline services every year. And there will be no layoffs, Mr. Speaker, absolutely no layoffs. We will not go back to the slash and burn cuts of the 1990s, overseen by members from that caucus in the past, that hurt families and undermined our public services. We will continue to support our health care and our education, Mr. Speaker.
Point of order noted.
Thank you, Mr. Oh, wait.
First supplemental.
Thank you, Mr. Speaker. I will follow with that then. Thank you, Premier, for that answer. Mr. Speaker, so my question now is to the Premier, is it your contention that up till now, between the time you were elected and today, that you haven't reduced hours or laid off teachers or nurses during this term of office so far?
Honourable Premier.
Thank you, Mr. Speaker. As I've indicated, there have been and will be no layoffs. What we have done is we've cancelled the unfair health premiums from the previous government. We've partnered with physicians and signed a new agreement to save $500 million to help slow the rate of spending growth and deliver better care. And we've moved forward on enhancing the use of affordable generic drugs where appropriate to bring in cost savings. We do need to control the rate at which our health care costs are increasing, and the Minister of Health is working diligently on that within the context of understanding the extreme value of our public health care system to all Albertans, Mr. Speaker.
Second supplemental.
Well, this is instructive, Mr. Speaker, because up till now the Premier and her front bench have all said that they couldn't possibly reduce any expenditures anywhere in their budget without laying off teachers and nurses. No, they said it repeatedly. I will say to the Premier, in between that, would you consider perhaps not spending $200 million on a laundry service for AHS that you don't need, and $50 million for a laboratory, because those are other ways that you could actually save the taxpayers money without laying off teachers and nurses.
That's right.
Honourable Premier.
Well, Mr. Speaker, apparently the members opposite want to lay off nurses, teachers, and laundry workers. But nonetheless, Mr. Speaker, I would urge the members opposite to read the budget that was introduced last March, because in fact we made it very clear there that it was our plan to try to slowly reduce the rate of increase in the healthcare sector. Under the previous deal signed by members opposite with respect to physicians, for instance, we were scheduled to see an 8% a year increase in 10% of the budget because of the AMA deal, for instance. And we understood that it was necessary to reduce that rate of